Hi, I'm Josi Henson. I'm a current pain medicine fellow at University of Colorado.
And hi, I'm Erika Petersen. I'm a faculty member at the University of Arkansas in neurosurgery.
And I'm going to be interviewing Dr. Petersen about peripheral nerve stimulation. So, Dr. Petersen, what are some unique challenges that peripheral nerve stimulation faces that spinal cord stimulation does not?
One of the largest challenges in peripheral nerve stimulation right now is the difficulty with access. The day-to-day practical of how you get a therapy for patients that may not be reimbursed. So in practical matter, it doesn't matter how much science we have or how much anecdotal experience we have in something, if you can't have access to paying for it, then it really is prohibitive to getting it to patients.
And do you see any big changes coming for PNS in the coming years?
Well, I do. I think there's couple things. In addition to the access problem, I just want to mention that part of the problem in the past has been not having devices that were specifically designed for PNS. Mm-hmm. And we now have specific devices with PNS indications and some science behind that to support it. So that already is a start to change. And what I'm very excited about is looking at how those new devices and other prototype devices may be able to actually go even further in terms of advancing the field, and if we can document with good clinical evidence the benefits of this, then we have a path to reimbursement and support for the therapy and access to patients as well. So to me, the future is bright because the more patients that we identify where we can do peripheral modulation for pain, and because patients may not be an epidural stimulator candidate, or maybe averse to wanting something that they see as a maximally invasive technology, then we have more access with more options for those patients.
Great. So for someone looking to break into the field of PNS, what indications have you found most successful?
So one of my most gratifying patient populations to work with are people with occipital neuralgia. We have published guidelines on occipital neuralgia through the AANS-CNS section on pain, which is co-sponsored by ASRA, and we know there's efficacy to it. The ONS doesn't have a lot of other solutions. It's not an area that is very easily addressed with an epidural stimulator because we're talking about scalp and head pain, although there is some potential to have some benefit with high cervical stimulation. And so if you're able to make a significant difference for somebody who can't shampoo their hair or lie on a pillow, that in my own clinical practice is really quite a gratifying patient to help. And so that's one of my favorites, but I think there's a lot of other things that we can see. The amputation population is an interesting population as well, where I think that having more options will help with advancing benefits for people who previously have had fewer solutions as well.
Great. And what is one takeaway you hope others will take from your lecture at the meeting?
So I think that one of the things about PNS that is important is just knowing that patient selection is the most important thing. Being a good judge of a candidate, of what their expectations are and what the possible benefits are of the therapy is the most important factor into long-term success. And it doesn't matter what the device is, how well you program it, how well it's implanted if the patient selection is wrong. And so we can push on the other areas of it, but ultimately all of these will come down to knowing that the patient is the right patient for the right therapy.
That makes sense. Well, that concludes our interview. Thank you so much, Dr. Petersen, for your time.
Thank you so much.